my name's Janine.
And I'm Femi.
I'm going to start with scenario one today. So, in scenario one, you're dealing with a client who hints that he or she is sexually attracted to you and may make a comment like, I'm not sure I can speak with such an attractive nurse. So, when using immediacy to respond to this, I would possibly say that I appreciate that you feel comfortable sharing your thoughts with me, but my role here is to support you in a professional manner in your health journey. So let's focus on how I can best help you. So I feel like this response helps set professional boundaries right off the bat. I do think it's important that the patient has boundaries, but in an empathetic way. So basically, we want to maintain the therapeutic alliance and avoid inappropriate transference between myself and my patient. And there's supporting evidence by Shea in the textbook that redirecting the conversation helps reinforce the professional nature of the relationship.
Yeah, I agree with that. Very good. Very well done. That's just similar to what I have here. I would just say I appreciate your honesty and the willingness to share that with me. My role here is to support you with whatever concerns brought you have brought in today, and it's important that we maintain a professional and safe environment for you to feel safe and comfortable in sharing. And I would redirect the conversation by saying, how are you feeling about the issues we were discussing earlier? Um, this using this immediacy would help addressing the comment directly while also maintaining professional, respectful tone. And by naming the situation without the use of judgment, I would have set a clear boundaries while also showing empathy for the client's potential discomfort, and also redirecting the client back to the main concerns to maintain tech therapeutic alliance and avoid derailing off the topic. And as noted by Shibib 2022, immediacy will help the counselor manage relational dynamics and maintain clear therapeutic boundaries. And the second scenario, the question is you're counseling a client who has become demanding. For example, he or she has been saying things like, if you can't talk to me for an hour, I don't think you care enough to help me. My response, using immediacy would be like, it sounds like you're feeling frustrated and maybe a bit unheard right now, which is completely valid. I want you to know that I do care and I'm here to support you. While our sections are of limited time, I am committed to making the most out of it. And let us work together in finding strategies that would help you feel supported, both during the session and when you're on your own. What do you think might help you feel more cared for right now? So the rationale behind this is that using immediacy here involves responding to the patient's present moment, responding to the patient's frustration in the moment, um, while acknowledging the client's feeling and also maintaining clear boundaries about the session duration, and also offering collaborative problem solving to help the client feel more empowered while also reinforcing the therapeutic relationship. And according to Shabib, it helps clarify misunderstanding and also create genuine dialogue.
Thanks. I really like your responses, and I just have one more approach that could be used that I can add to yours. But I loved how you used the validation in the first part as well. So I went with the approach of when Shay in the textbook highlights the importance of prioritizing patient concerns, um, but also maintaining clear expectations, and especially around time constraints, because that happens a lot in nursing. So I made a statement that says that I appreciate that you value our conversations. I do want to ensure you feel supported and heard. Um, I do have limited time, but I want to make the most of it with you. So let's talk about what's the most important things on your mind today. So with scenario number three, feeling confused in an interview. So you're feeling confused and you are not sure what to do next in the interview. First of all, that is a terrible feeling, especially when things can get off topic easily. I think to use immediacy, you would want to make a statement like, I do want to make sure I fully understand what you're saying because this is really important. So could you clarify a bit more so we can work together, or work through this together? And the supportive evidence I use from the textbook is just involving active listening and clarification, um, just to, and also normalizing uncertainty and inviting collaboration enhances trust in the therapeutic relationship. Um, I think it's good for when you get confused to just stop and start, like, just ask the patient to clarify where maybe where they're getting at or where the conversation is going or what their goals are, especially if you get off topic, or the patient is tangential when with their thought process when you're talking to them, just to keep bringing it back to the main goal of the conversation.
Well, that's well said. Yeah, and I agree completely with that. And I think this happened more often than that I've noticed anyways, and even with me, and I've learned a lot. I've learned to know how to respond to these with this exercise. I could probably ask the patient I mean, I could start with a conversation like, I want us to pause a moment here, because I've realized that I'm feeling a little bit uncertain about what you're trying to communicate. I really want to understand this correctly because it seems very important. Would you mind explaining it again or maybe giving me an example to help me, understand you better? You know, acknowledging here immediately, sorry, using immediacy here. Um, Means the counselor is acknowledging that he's not understanding rather than getting confused and pretending to be understanding what they're saying. It's better to be honest. It shows that the, the counselor is being honest and demonstrate commitment to understand the client completely. And it also gives the client some sense of, um, it shows this client that the counselor is actually listening and trying to understand, rather than just assuming and making assumption. Um, According to the textbook, it strengthens therapeutic alliance and models open communication and transparency. So this will lead us to the last question, which is, your client continually questions your training. For example, saying things like, "You seem really young. I'm not sure you can help me with this problem. Did you go to school for a certificate? Because I'm not sure you know what you're doing here." Um, First of all, that can come out to be very rude, and it needs to be, and I've actually experienced that before. So this is actually a good learning curve and exercise for me to practice. I will start with a statement like, "I hear your concern um, and I'm here. I want you to know that I'm here. Sorry, I hear your concern and it's completely understandable to wonder about the experience of someone trying to help you with something so important. I do have training and experience in supporting individuals who are dealing with similar challenges. I am committed to working with you to find solution that can help. You can tell me more about what concerns you the most right now so we can walk through it together." Um, Here, using the immediacy requires addressing the client concerns about the counselor's competency, validating the client's feeling, and providing reassurance about the counselor's qualification would help, you know, give a sense of trust and a sense of confidence and help clear the doubt going around. It also demonstrates professionalism while encouraging the client to shift focus back to their concerns.
I really like that. I agree with the response, and I thought about adding some other things in. So I did put a response that I understand your concern, but I want to reassure you that I've been trained to support you. Um, and my priority is to ensure you feel heard, but also just reflecting on that my age and my life experiences and my perceptions are not going to reflect on how I help you. Um, I am trained to guide you in your own recovery and to understand what you're saying to me. So basically my age has nothing to do with it. I am trained in guiding you in recovery. Um, and I also think that like this is really important to use immediacy and or else it could build up. So just to tell them right away, um,
Hmm.
and handle their skepticism with confidence and
Hmm.
reassurance. So being confident in giving your response to that is important. Um, and that is also reflected in the readings by Shay, um, who also talks about a direct yet empathetic approach strengthens your credibility and engagement. So that's all I have.
Thank you.
Okay, thank you.
Did you stop the recording?
No, oh, here it is.